For more on the impact of social distancing, CBS News chief medical correspondent Dr. Jon LaPook joins us via Skype from his home in New York City. He is self-quarantining there after possibly coming into contact with someone who tested positive for COVID-19. More and more people are in that situation these days. Good morning, Dr. LaPook.
Morning, Tony.
We're dealing with these very dizzying changes in everyday life. The restrictions and advisories have gone from don't go to Italy now to don't go to your corner bar and don't gather in groups of more than 10, all in the name of social distancing. How much of a benefit do we expect to get from social distancing?
I think there could be a very big benefit, and I will tell you why. We talk about, again, this flattening of the curve. But early on with an epidemic, you get this big peak. With that big peak, big load on the healthcare system, you can have shortages of healthcare professionals and supplies, as you're hearing. Does it work if we can blunt that? If we can blunt that curve and flatten it out, and instead of having one big spike, spread them out a little bit. It may last a little longer, but you won't have that big load at that point. Does it work? Yeah, we're seeing in China, in South Korea, elsewhere, these kind of efforts make a difference, and we're seeing a slowing of new cases. So yes, it matters, and especially people who are young. You heard President Trump talk about the young and the healthy. It's important for them also, even though they may be relatively spared from the severe effects of COVID-19, they can spread it to others. So we're hearing reports of young people out in the streets and still, doing the normal gathering. And don't do that, because you may bring it asymptomatically without symptoms or with minimal symptoms and infect your mother, your grandmother, et cetera. So everybody has to be responsible here.
Yeah, that's why they said millennials are the key to spreading this, John. What about play dates for your kids? Is that a good idea? Is that okay?
You know what you have to think of course, with kids, when you have, kids are mingling, there's no way you're going to say to them, listen, stay 6 feet apart and cough into the crook of your arm, right? You have to assume you're mingling germs with kids. Then you have to think of, what are their contacts? So if you're with a child, if your child is with a child, who's in contact with them? Is there somebody in that family who's at high risk? High risk means somebody with an underlying medical condition, serious medical condition, like high blood pressure, heart disease, diabetes, of course, a weakened immune system. And then the question of if they're with somebody who's elderly. Now, I've been trying to hunt this down. What's elderly? Gail, you may be like me. Elderly is somebody at least 10 to 15 years older than whatever I am at that moment, right?
Exactly.
But I actually checked with the CDC. They're kind of like, well, 65 and above, but there's very good data here to look at it in the current situation. If you look in Italy, you see that the mortality rate really spikes up from 70 to 79 and above. Yeah. It's not like 69 you're fine and 71 you're not fine, but I think that's a good sort of idea. It gives you an idea of a data point of what might be a time where your risk really goes up.
All right, Dr. Jon LaPook. Thank you, John.